with us from the Ministry of Health and Wellness, it's myself, Melissa Diaz-Musa. I'm the Director of Public Health and Wellness. We have Dr. Natalia Baer, who is the Technical Advisor for the Maternal and Child Health Program. And we have Dr. Russell Manzanero, who is the epidemiologist here at the Ministry of Health and Wellness. We also have Dr. Vic Rosado, who is a pediatrician, and he's also a member of the NITAG. So he's also online. What we want to do is I want to start by just reading a statement. And after the statement, we will then open up for questions from you all. Is that okay?
Yes, please proceed.
Okay. On April 12th, 2025, the Belize Ministry of Health and Wellness confirmed 2 imported measles cases. Belize's first since 1991. This is 34 years ago. The cases are individuals from the Corozal and Cayo districts who had recently traveled to Mexico. The information thus far is as follows. The group included 15 travelers from 4 communities in Belize. These persons traveled to Chihuahua, Mexico around the 5th of January 2025 and returned to Belize around the end of March 2025. Of the persons with this similar travel history, 13 are asymptomatic, of whom 11 are vaccinated. 2 unvaccinated persons have developed symptoms in Belize and were tested positive for measles. The details of the 2 positive cases are as follows. A 17-year-old male, unvaccinated, who started with fever, rash, and cough on April 3rd. Laboratory confirmation of measles was received on April 12th. The second case is a 17-year-old female, unvaccinated, who started with symptoms on April 2nd. Laboratory confirmation of measles was received on April 12th. All 15 travelers have been interviewed by the staff of the Ministry of Health and Wellness and are being monitored regularly for signs and symptoms. These cases emerged amid a regional surge in measles across the Americas. Between January and March of 2025, 507 confirmed cases were reported in countries including Canada, the United States, Mexico, and Argentina. This represents a significant increase compared to the same time period in 2024. Measles is highly contagious.
Hello. It broke off.
And I'm not sure why, because it shows good internet there.
Let me go and check on them, guys, and we'll get back to you. This is just about 5 minutes. There is no time limit on this Zoom call, so don't worry, we'll get everyone here.
Our apologies for that.
So
Can you hear?
we can hear you, we can see you, but are you able to resume where you left it off?
Yes, we got back on the hotspot. Thank you. So I left off that Belize started the measles vaccine in 1973, and we progressed to the MMR vaccine in 1996 to present. Within this time, mop-up campaigns were conducted to ensure that persons born prior to 1973 were vaccinated. Despite our great efforts in ramping up the vaccines, Belize remains below the target percentage of 95%. In 2024, Belize reported a country percentage of 83.9% for the MMR2. There are many communities countrywide where the target percentage remains low. And it is in these communities that our team of healthcare workers are putting much effort. The vaccination coverage per district will be shared with the media team here today. However, it is to be noted that the Cayo and Belize districts reported the lowest vaccination rates of 73.5% and 79% respectively, with the highest being recorded in Corozal at 93.9% for the year 2024. Belize currently has 39,000 doses of MMR vaccine to improve our vaccination coverage, and a kind offer from neighboring Mexico to increase the supply of vaccines if needed. The Ministry of Health and Wellness urges the public to ensure vaccinations are up to date, particularly for children. Parents, check your children's vaccine cards to determine if their vaccines are up to date. Adults who have not received an MMR vaccine or who are uncertain of their vaccination status should visit a health facility to receive the vaccine. The Ministry of Health is also enhancing surveillance and contact tracing efforts to contain the potential spread. We're doing this by educating the public on measles, by actively looking for cases, testing any suspect cases early, and by ensuring increased access to healthcare and to the MMR vaccines. The Ministry of Health and Wellness is urging the public to stay alert. Report any cases of fever and rash illnesses to the nearest health facility without delay. This will allow healthcare workers to advise and treat cases rapidly. Please take note that our 0800 MOH care number is also currently active. Thank you. I would like to now open the floor for questions.
Yes, hello. Good morning.
Good morning.
Thanks for your opening remarks and that overview. So the first thing I heard about this case from April 7th, and at that time I'm told that it had been flagged from a week earlier. Of course, I'm such a good partner to the Ministry of Health and Wellness that I didn't say anything. Anyway, but why didn't you all say something earlier? I know it was just a flag, but we know there was a clinical presentation. Had you not, if you had spoken earlier, wouldn't there have been greater benefits to public health or public awareness that this thing is in Mexico, we have to be more careful, etc.?
Well, with regards to these two cases, or with regards to the way that we investigate, not because we haven't made a public statement that we are investigating, does it mean that we are not doing all that is needed to contain and to isolate persons. So when we got the notification, immediately our health team went that said day to investigate and to do a report and to put things in place to ensure that there will be, so when that we are potentially containing any spread. The issue as well is that by epidemiological definition, we cannot say to the public that there is a measles case. We don't have laboratory confirmation. And the presentation is oftentimes a cough, a runny nose, dry red eyes, with the appearance, plus or minus, a rash that comes on a few days after the fever and the coryza and the cough. So it is not our practice to say, yes, we have a measles case and we have no confirmation that there is a measles case. So we ensure that we isolate, we follow up the cases on a regular basis. We took samples from the persons and then we await the results.
Would it have helped to put an epidemiological alert, because we know the Guatemalans did one in March? I understand without confirmation. You can't say anything in absolute terms, but I'm just, as you know far better than I, Dr. D.S. Musa, public information is one of the most effective um, public health tools.
Yeah.
Should we have put up an epidemiological alert as the Guatemalans did in March?
Well, we have been, in fact, coincidentally, we drafted a press release even before the case was reported to us. And we have also met with our health educators. We're currently printing out health education material. And we started with a more broad health education by encouraging people to vaccinate. We have also been doing mop-up campaigns every weekend from the start of January this year for us to try to ensure that we reach the target of 95% for this year. So we have been doing quite a lot prior to us having the case. And of course, we keep in contact with our regional colleagues and partners, and we monitor what has been happening. It's by coincidence that when we did the press release for last week, Wednesday or Thursday, when we got the report that there, or Friday, that there is a possible case of measles reported. So things were going into place, and we have absolutely nothing to hide from the public. We have our Facebook page, we have an Instagram page, and we always promote our vaccines, and on those pages we also put a lot of health education and health information. We have also been in the process of updating our epidemiological clinical management for measles. So all these things have also been happening.
I didn't hear it in the opening, but where in Mexico did they travel? And what level of awareness and alert should Belizeans be under?
The 15 travelers traveled to Chihuahua, Mexico. We do know that officially from the last epidemiological bulletin from PAHO, Chihuahua had reported 4 cases. I think this has increased since because 79 was reported. 79 cases. And we so far do not have a travel alert out for Mexico when it comes to the contracting measles. We have been working, as I had mentioned, on health education, general health education, and we've been working on mop-up campaigns to try to get our numbers up as quickly as possible.
We know that Quintana Roo has reported 6 cases, and Yucatan another 2. What should be the level of vigilance and awareness?
Why you have to show my name?
Please mute this person. Thank you. Yeah, so we know that Quintana Roo has reported 6 cases. Yucatan has reported 2. What should be the level of awareness for Belizeans traveling into Mexico?
Dr. Bear, we can't hear you. Please unmute there.
Yes. Any unvaccinated person traveling abroad and coming in contact with persons that may be infected with measles, more than likely will be infected with measles. So we have so many flights in and out of Belize, and if we look at the data in the US, a lot of destinations from Belize, they're having outbreaks. But I think the key message here is for, if you are going to travel, make sure you review your vaccination status. And ideally, you should get vaccinated before you're traveling, because these cases is just the perfect formula for importation. Unvaccinated and coming in contact with a person with measles. Now, the issue with measles is that the person is contagious even before having signs and symptoms. So it makes it more difficult for one to say, well, I will stay away from persons that are ill with fever and rash, but the contagious period starts even before that. So it makes it more difficult. But travel bans, so far, I don't think that's the way to go. The protection for the community starts with the protection of the individuals. If we want to protect our population against measles, the best and most effective protection is to get vaccinated.
All right, so good morning, everybody. I heard you say, Dr. Musa, that the country with the district with the highest vaccination coverage is Corozal. Did I miss the portion of Belize that has the lowest, and what are your efforts to go into that area and to get those people vaccinated, please?
Yeah, the district with the lowest vaccination coverage for MMR2 is the Cayo district with 73.5. And I can tell you that we have a network of public health nurses that are visiting the communities. We used to visit the communities every 2 months. And for a good while now, we are visiting communities every month offering the vaccines, but we still have low coverage. And we need a cooperation from the community to look for the kids, look at their cards, as Dr. Musa was saying, to make sure that their child is protected against measles. And the high-risk group that we need to target now is unvaccinated children and teenagers, unvaccinated adults from 20 to 59 years, adults greater than 60 years, unvaccinated healthcare workers, immune-compromised persons, pregnant women, and the population living in communities with low vaccination coverage. So we have the coverage by community, and we are starting with the lowest to the one that have the highest vaccination coverage, to go and look for those, to go and look again for those 0 doses or those who have incomplete vaccination schedule.
Dr. Bear, good morning. Marcella Maya from News XTV. For an adult, they don't have access to their vaccination card. How would they be able to tell if in fact they are vaccinated?
People can recall, especially the elders, if they had the disease or if they were vaccinated. And if we cannot find the records, then they're due to get at least 1 dose of MMR vaccine.
And is there any way for us to know, or you as officials to know, if trust in vaccines has eroded in Belize after the COVID-19 pandemic? Are you meeting any resistance in communities because of any erosion in trust?
Well, that's an excellent question. And yes, we had a higher acceptance rate of vaccines before COVID, although worldwide, we have seen a decrease in the uptake of the vaccines, because that's why countries are experiencing now outbreaks. In our case, well, until this year, but you have countries that have years with measles outbreak because their communities refuse to accept the vaccine, and now they're in problems trying to increase their coverage. But yes, we do recognize that there is vaccine hesitancy, so more education, more information needs to be available, warning the population that measles is preventable with a vaccine. And we will make all efforts, as Dr. Musa said, to ensure the population have access to vaccines.
What is the practice internationally in terms of airport travel? So it's already been pointed out, we have a lot of, not a lot, we have direct flights from Texas to Belize, and Texas in the US is the area that has the majority of cases. What is expected in terms of protocols for travelers coming in?
Similar like other countries, Marisol, when you walk into the airports, they have signs and symptoms of measles and report if you have any of this, present an illness similar to measles.
But is there increased surveillance at the border? People going on vacation won't, in general,
Yes.
self-report. Are there health officers doing actual surveillance of all air and land crossings?
Yes. Well, the process in Belize and in the Ministry of Health and Wellness is that we do have public health inspectors trained in surveillance at our borders and at the cruise ships. So the public health inspectors have numerous roles when they're at these border points. And one of the roles is in surveillance. And we have now, in fact, the regions are meeting today and some met yesterday to enhance this surveillance. So the enhancement basically means that we're actively looking for cases, reaching out to people who have been sick, because of course, a part of the public health inspector's duty at the border points, especially for the airport, is to look at the report that the captain sends out just prior to landing, identifying whether somebody is ill on flight, etc. And then we take action depending on that. But as Dr. Bear mentioned, we will also have our posters. The public health inspectors do ask about fever. We try to identify early if there are any sick families in the group, or and we then give advice and isolate as needed. So this will be enhanced. We will more than likely, depending on the regions, because not all regions, the response will be the same. The borders, of course, are a little bit, the land borders might be different than the cruise ships and the airports. So we will adjust for each border, and we will enhance the surveillance at those places.
For the benefit of people who don't know, how long does measles last, and the after the vaccination, when does it take effect? After the vaccination is administered, the vaccination.
Community.
Well, we have Dr. Vic Rosado online. I don't know if you, Dr. Vic, would you want to answer with regards to the clinical findings, or is she on?
It is recommended to get vaccinated at least 1 month before traveling for us to be able to get protected against the infection and disease.
So to go into a little more detail with regards to measles. So measles, it's a viral infection. The incubation period is usually between 10 and 12 days, like many other viruses, but the difference with measles, it can last up to 21 days. For that reason, we've got to continue to monitor for a longer period of time. Once somebody is infected, what we would tell the family is that that person was infectious 4 to 5 days prior to the rash. Once you see the rash, they remain infectious 4 to 5 days after the rash. So that's similar to, for example, chicken pox that many of us have had and have dealt with. We know that a few days before and a few days after are the times when you're most contagious. As Dr. Bear mentioned, the travel advice is at least a month before, if not at least 2 weeks prior to your travel, you're advised to get your vaccination if you are unvaccinated.
I want to ask, obviously, the memory of what we went through with COVID, I think is still very present for a lot of people. And you're being told it's been over 30 years since we've had cases of measles. Like, how concerning is it that we have these cases again? And Dr. Bear, I don't know if you would have the historical memory as to what was our situation back then in terms of the percentage of vaccinated population and then the numbers of cases that we had back then.
Okay, if we go back and look at COVID, the situation with COVID-19 is that we were faced with the COVID-19 pandemic with no persons vaccinated against COVID-19. And then we went from routine vaccination of 7% of the population to trying to vaccinate 70% of the total population. The situation with measles is a bit more concerning because of the transmissibility. One person that is infected can infect 9 out of 10 persons. The spreading of the droplets when a person breathes, cough, sneeze can remain in the ambient up to 2 hours. And contaminated surfaces can also have the virus there that can be transmitted within that 2 hours. And the reach of that transmission is 12 feet.
Okay.
12 feet. So if you compare the data with COVID and measles, measles is more contagious than COVID-19. Hence, but the situation that we are stepping in with this measles outbreak that we have, one case in Belize is an outbreak. We have a large amount of the population vaccinated. So the urge is for persons that are unvaccinated or cannot remember if they were vaccinated or not to get vaccinated. It's the only way we can stop the spread. So we need the collaboration from the entire community. And this collaboration needs to come from all communities countrywide. We can't wait until we have a case in Toledo to start working in Toledo. All the teams countrywide are activated and working in the field with the communities. And we have increased the active search of cases in health facilities and also at community level.
I just want to reiterate what Dr. Beer said in terms of comparison of COVID and measles. COVID was a novel virus. We knew nothing about it. With measles, we do have a large percentage of our population vaccinated, and we do know a lot about measles. So the pros to it is that we know what can prevent spread, and we know how we can go about doing that, unlike COVID.
Would you
39,000, the vaccines that you say you have available, will that get us to the 95% coverage that you are seeking, or will you need to acquire more vaccines?
The coverage that we shared with you is the coverage of the target population that receives routinely the MMR vaccine. So that is children below 2 years. The 39,000 is much more than what we need for that target population. But because of the outbreak, we definitely have to cover population outside of that age group. And we have received confirmation from Mexico that if we need vaccines, we can count on them for any amount. So vaccines, access to vaccines would not be a problem.
So you said any age group. I'm just checking. Persons above 60 as well?
Yeah, persons above 60 years. Unvaccinated persons from 20 to 59. Unvaccinated children and teenagers, unvaccinated healthcare workers. We are updating the census of the healthcare workers to ensure that everyone is vaccinated. Immune compromised persons, pregnant women, and population living in low vaccination coverage communities.
And immunocompromised, just to add, would be persons who do not mount a significant immune defense. So diabetes is an immunocompromised state. Persons who have cancer, HIV infections. So it can be a wide array of persons. Even persons over 60, your immune defense can start to drop. So these persons, unvaccinated persons, should seek care and go to their nearest health center for their vaccine.
Okay, and that's what I'm trying to clarify. So persons over 60, because I heard her say 20 to 59. So
Unvaccinated.
Vaccinated 29.
Okay. Please explain that to me again. I apologize. Sorry. Mel,
Right.
the same thing Melissa said. The same thing Melissa just said. I didn't hear the full thing.
All right, some high-risk groups are
No,
unvaccinated.
okay, I got that. What the high risk groups are. Unvaccinated 20 to 59, you said, right?
If they're unvaccinated. So that's, okay, just put it where that is in his question. Well, as Dr. Musa was saying, greater than 60 years, and persons, that have, diseases, chronic diseases, should get an extra dose of MMR vaccine, even if they are vaccinated. That is what they're recommending.
Okay, good. I got that crystal clear now. Thanks. I apologize for the confusion at my end. Also, what in terms of the I know we spoke about the decrease in the coverage of vaccinations, and in 2021 this was experienced, COVID, etc. Has there been a continued increase in the rebound for persons seeking vaccinations, or is there still like a fixed level of public resistance to resuming the very good vaccine regimen that Belize once enjoyed, the very high level of penetration?
Well, we would have to look at the recent data to confirm if there is an increase of the uptake. But we will probably share next time that we meet the coverage for this year so that we can compare.
So, but
So
how far away are we from pre-COVID numbers? That's what I'm trying to find out.
how far are we from?
How far away are we from pre-COVID numbers in terms of the uptake of the standard vaccines?
We have a good track of reaching 95%, but 2-3 years before COVID-19, worldwide, there have been a decrease in the acceptance of the vaccines. You know that access to information include access to misinformation. So we understand that all those resistance from developed countries trickle down to our country, and then COVID-19 just come and had more negative effect than positive effect on the vaccination. So we are increasing the coverage, but we are still not where we should be, 95%. And it's not only Belize.
It's a global.
It's a global trend, right? And that's the worries from the World Health Organization. Another expert, like the SAGE.
Okay, and then we spoke about the issue of Texas earlier. We know that there is a high level of vaccine resistance growing level of vaccine resistance in the US, and Texas is one of the foremost states. These people are arriving in the country and they're having daily contact. We have two flights coming out of, or multiple flights coming out of two cities in Texas every day, Fort Worth and Houston. How concerned should we be, and how do we protect ourselves? These are tourists, and they're coming on vacation.
Well, once again, as we mentioned, getting your vaccine protects you. And so that's the best way that we can do it. We've mentioned our heightened surveillance, identifying cases early and isolating cases early, and of course, ensuring that we're vaccinated.
Speaking of communicable diseases, should we be concerned about whooping cough? We know that there are hundreds of cases have been reported in Mexico. I think about 300. Is that a concern for Belize as well?
We have, as part of the expanded program on immunization, we have the surveillance of vaccine preventable diseases, and whooping cough is included there. We have had some small outbreaks almost nearly every year, but one factor is unvaccinated children. So we know that the virus is circulating, but the level of vaccination is helping for outbreaks not to occur or to stop the spread of any outbreaks that we may have. So we have had small clusters of persons infected with whooping cough, but there are children not vaccinated, unvaccinated children.
Good morning, everyone. Just want to take a little break here and ask any other media hosts here represented if they have any other questions. We want to give opportunity to everyone. I know we have Love FM, maybe TV3. Anyone else? Just let us know.
Hi, good morning, Rennie from Love FM. Just one quick question. We talk about basically being able to adults who are unvaccinated or didn't receive the MMR2. For those who don't have their health records or who probably won't remember that far back, how easily accessible is that record for persons who perhaps don't recall whether they got the shot or not?
We are prepared to provide the access to the vaccines, the persons who are unvaccinated, the persons who have incomplete vaccination, the persons who have proof of vaccination that the vaccination was incomplete, or the persons who have no form of documentation, cannot recall if they were ill with measles as a child, or cannot recall if they were vaccinated. So there will be no discrimination in this case for persons seeking vaccines. What we do recommend, if you have 2 doses of vaccines, you don't need to come and get a third, because then that dose can serve someone that is unvaccinated. But having proof or not having proof will not limit access to MMR vaccine.
But in terms of your health records, how far back does that go? And 2, for example, if I got my 2 MMR shots, but I'm not certain, I'm not sure.
We have records.
So you still use your archives in order to be able to check that? And if I do get a dose of the vaccine, and that would be my 3rd dose, would that pose any kind of health risk, anything like that?
No health risk. And we do have records, maybe not for everyone, but if you show up to a health facility and say that as a child you were attending that clinic, they can look up your record. We have provided record for persons 50 years old, but sometimes we cannot locate the records. And remember, we were using only paper before, so paper gets old and destroyed. So that's what I'm saying. If you don't have documentation and we cannot find documentation, you will get vaccinated if you request it.
I think that the message should be that if you're uncertain or if you feel that you were not vaccinated and you don't have any recollection of your parents or whoever discussing the vaccines with you, come in and get a vaccine.
Morning. I wanted to ask, what would be the advice for parents who have younger children, who are not yet at the age to get the vaccine? I know that parents with younger kids may be, worried at this time, especially as the announcement of a case. So what would be the advice for them?
Well, with regards to the travel advice, that would be different than regular advice if you're not traveling. But the WHO, they have advised and they have printed that if you are traveling to an area that's high risk for measles, that if you do have, as Dr. Bear mentioned, either a month or up to 2 weeks before, if your baby is 6 months through 11 months, you should get 1 dose of the vaccine. Everyone 12 months and older as well should get the 2 doses of the vaccine. That's for travelers, so I want to make that clear. If you're traveling to an area where there is active transmission. But Dr. Bear, you could go ahead with protection.
Yes, the routine dosage is the first dose at 12 months of age, and then the second dose at 18 months of age. In this case, we are still revising if we need to drop it to 9 months, and then that would be a 0 dose. And then we follow the scheme with 12 and 18 months. But we will have to finalize that technical.
Trying to ask you a question about maybe you don't ask you a question.
Dr. Bear,
Yes, Nelson.
yeah, can people be infected and be asymptomatic?
Could be. I don't know of any case because to run the samples, you have to meet criteria for a suspected case.
But I think what you're asking is if you could be in the incubation period, correct?
With no
No.
symptoms.
With no symptoms.
Well,
So is that what you're asking? If you are case but you haven't shown any symptoms, can you still be infectious? That's the question.
if you are exposed, do you don't get tested?
That's right. So remember that we had mentioned earlier that the incubation period is generally 10 to 12 days. So if you are exposed to somebody with measles and you know that they have been confirmed with measles, we ask you to isolate for 21 days because although the majority of persons who would have become infected would show signs and symptoms within 10 days, that incubation period can be up to 21 days. So if 21 days has passed and you didn't get your fever, you didn't get a cough, runny nose, and your rash, you are not infected with measles. However, the most contagious period of infectivity is 4 days before your rash appears. So you might feel well, or you might have just what we call a prodrome. You might have started a headache or have a little runny nose, and you don't have any rash. But then when you start with your rash on day 0, 4 days before that, whoever you mingled with or whoever you were associated with, you could have possibly infected. Once you have your rash, and we do your sample, that you've met criteria for us to check for measles, 4 days after you remain highly contagious.
Mm-hmm.
So those are the important messages as well that we need to make clear to the public. So yes, you could be infecting persons if you're already infected and you may not have a rash as yet. So as I mentioned earlier, another disease, another virus that's similar is chickenpox. Many of us, our children have chickenpox and we see how it spreads. And we know that 5 days before you see the first rash, that child was contagious, and that's why you see like it spread in classrooms, and 5 days after. So it's very similar with measles, but we've got to keep in mind the incubation period of 21 days as well. So those are the days that we are working with as the health team when we go into the household and when we give advice.
I think just to add.
What is the worst case scenario for somebody who's infected by measles?
Worst case scenario for someone infected with measles, can you?
Mild, severe.
Oh, okay.
Yeah, just to finalize it with the comment before, asymptomatics and those who might develop or don't have symptoms. Remember, there are individuals who have weakened immune systems, so the way how the presentation of symptoms varies. So even though you might be vaccinated and you're already over 60 and you have these weakened immune system, your level of how you display these symptoms might change. You might just appear with just a fever. You might not have the pronounced rash. So that's the point that Dr. Diaz is mentioning, that even though individuals are out there, you're still within that time frame to be exposed to someone who might have very minimal symptoms and you can still get infected with measles. The only way to prevent it is, of course, being vaccinated. In regard to the severity, yes, I believe earlier Dr. Bear had mentioned which are those high-risk groups. I mean, the very young, those who are older, pregnant women, those who have a weakened immune response, such as those perhaps living with cancer or one of the chronic illnesses that are perhaps not managed properly. Those are individuals who have weakened immune systems. So those are the persons of concern of where the severity might be even greater. And it varies. It varies from perhaps you might have a lung infection, you develop pneumonias, you can have inflammation and swelling of the brain. But these are instances where hospitalization rates perhaps are not that great. These are the very severe cases. In that instance, if you do have a neurological complication, that you do get a swelling to the brain, you might have sequelas or side effects of hearing loss or vision loss, blindness. Yes, there are some cases of death, as you are aware. We can have death as well, presenting in measles. In pregnant women, the concern is, of course, premature births. So those are the instances that we're talking about. Yes. So we have low birth weight, stillbirth, premature birth. So those are the instances among pregnant women during this case. Okay.
Did we have any deaths back in when we had our outbreak over 30 years ago? And then I don't know if I missed it. Is the case of the two index cases, are there mild cases?
Yeah, they have recovered very well.
Do you know the history of the outbreak, huh? If they were.
Yeah, yes, we did have deaths. I don't have the numbers right now, but then, yes, we did have experienced deaths due to measles before the introduction of the vaccine. And I would like to remind you all about the post-exposure prophylaxis. What that means, if you come in contact with a person that is confirmed case of measles, and you're unvaccinated, and you get your vaccine within 72 hours, your protection, the effectivity of the vaccine is from 83 to 100%. So if people can take note of this, that would be great, because it's a way how we can stop the spread. So even if you're coming in contact with a person that you did not know, but you know today that they are positive, and you are still in that window period of 3 days, please get vaccinated, because the effectiveness for you is 83 to 100%.
Yes.
Hey, guys, let me just quickly interrupt again. We are looking to wrap up. Let's have 2 more questions, and then we can proceed.
Thank you, John. I just wanted to mention that we will share some information with the media. Dr. Bear has a PowerPoint that we can send so that you can look at some of the data that we've collected over the years as well.
Okay, real quick. I know that many people are in my situation where in the 70s I caught measles, as many people did, and then later on, probably in the 90s, I got a MMR vaccine. Someone in that situation, what should they do? Should they seek to get a booster, or did having contracted it, did they get immunity for a lifetime? And since I'll be cut off by Aaron, I really apologize for asking this question. And I know Belize is certified malaria free, but I have received reports that there is a cluster of suspect malaria cases in the Cayo district. So I'll ask you to please address that, and I'm done.
Mr. Jones, I think you are double protected, because you got the and then you got vaccinated. So yes, you are one of the few that got double protection. Good. Yes. Any other questions with regards to measles?
I'm asked about the malaria though.
Yes. Well, we actually do have an interview scheduled to discuss the malaria situation. But I think that for this purpose, we should stick to measles, and then we could address malaria at another interview. Because the technical advisor from malaria would want to be on as well to give more information with regards to what we're doing for malaria. And just to advise you that when we as a ministry state that we have eliminated or we have received certification of elimination, many times it doesn't mean that there's 0 case, but you have fallen below a certain threshold. And we also, WHO looks at consecutive years of how the country has responded before they can determine whether that certification has been removed or whether we remain with the certification. So it's not a hard and fast one-off case and their certification has been removed. So just wanted to clarify that, but we can talk about malaria at another interview.
So then I'll take the last question, and it's about side effects of the vaccine. Thank you so much.
Okay, the side effects are common side effects like in any other vaccine. Redness on the site of injection, pain on the site of injection, and there are a few other side effects that are rare or not too common. So we usually recommend the parent, please report to us any reactions to the vaccines so that the nurses can follow. But it's a vaccine with just the common side effects.
We had one more question from Mr. Aaron Holmes. I think we could take it.
Yes, go ahead.
Hello, Aaron. If not, then I guess that would be it. And Doctor, I'll pass it to you for a closeout.
Well, I just want to conclude by once again thanking you all for joining us and for allowing us to give this information to the public. I want to keep for everyone to keep in mind that we will be sending out frequently asked questions, answers to these questions. We will be circulating more health information on social media, especially with regards to vaccines and who should come in. And you will see our health teams more in the community. As I said, from January, we've been doing weekend mop-ups for vaccinations, among other things as well. So this will also be heightened. We want to ask the public to please cooperate with us in terms of if you do have or if you do know of any suspect persons with fever and rash. It doesn't matter if there is no travel history, anything of the sort. Please report it to us so that we can do the investigation. The earlier we detect, the earlier we can contain any potential worsening of spread. So those are important information. And of course, a big thanks from us to our health team on the ground, the persons working weekends, the persons going into these communities and actively ensuring that we contain spread. Thank you.
Thank you, everyone.
Thank you.
Much thanks.
Thank you too.